Hi everyone, my name is Kate DeBartolo and I'm the Senior Director of the Conversation Project. I'm so excited to be with you here today. The Conversation Project is a public initiative campaign within the Institute for Healthcare Improvement. Our goal is simple but transformative, to help people have conversations about their wishes for care now and through the end of life, so that those wishes can be understood and respected. We've been around for about 10 years, and today I'm just here to share with you some of the tips that we've learned to maybe make these conversations easier for you. So one of the reasons that we think conversations are so important and what we want to emphasize is that we can't plan for everything, but we can share what matters most to us with the people who matter most to us. There's a lot in serious illness that is out of our control, and we can gain back some of that control by talking about our wishes. And also that this really helps create the foundation of a plan on our values. We can clarify what matters to us with the people in our life. And we're going to share a little bit more about that and why that's so important. One of the things we talk a lot about talking about what our wishes are. We have no preference for the type of care somebody may have in their life, and it's really important to listen. So especially as caregivers, as we encourage these conversations to be happening, we want to be sure that we are listening, we are not reacting and responding with our own biases and what we would want for someone. We want to be thinking about what they want. And especially when somebody is living with a serious illness or towards the end of their life, this can provide so much comfort and, again, that sense of control. So I'm going to share a little bit about why it's so important for us to talk about things, why talking matters. We know that we can't plan for everything, but we can share what matters to us with the people who matter most to us. Especially when living with a serious illness, there can be a lot of emphasis on what's the matter with us. And we want to focus on what matters to us, so that medical decisions are made based on our values, the things that are important to us, the people that are important to us. So having a little bit of control back when things feel so out of control during a serious illness can be an important part of why we have these conversations. The others is that talking creates this foundation of care for a plan that can be built on those values. We know that a crisis is a really hard time to learn. So for us, we would rather have these conversations happen at the kitchen table in a more casual setting before a crisis arises and not when we're in the ICU or trying to connect family members who can't get on the same page. That's why for us, it's so important to have these conversations early and often. We also find that they are a real opportunity to strengthen relationships, especially when somebody might have received a new diagnosis or have a new prognosis. And it's a real chance to feel fortified and that you're not alone in having these conversations together. Because of that, we talk a lot about having conversations, bringing this up, talking with other people, but we want to be careful that you're not talking at somebody, but you're listening to what matters to them as well. Listening is such an important part of conversations for somebody to feel heard and respected, especially if they've recently received news about their diagnosis. So this is just something that we think is really important and want to name, especially if you're feeling like, yes, I know I want to bring up this topic with my person. I know the kind of care they would want to receive. This is a chance for you to really listen and think about what they might want. As Dr. Atul Gawande, who's a physician and author of the best-selling book Being Mortal, says, our ultimate goal, after all, is not a good death, but a good life till the very end. And that's what we're going to be focusing on, how to live your life till the end the way that you want, the way that you would choose. So the Conversation Project has a variety of resources. I just want to help you be aware of those before we go into some of the tips. These are free, they're available in English, Spanish, and Chinese, and you can download them off of our website. Everything from how to choose a healthcare proxy to how to talk to a healthcare team, what to do if you're a caregiver of somebody who might have Alzheimer's or dementia, a variety of different topics. So you can check those out on our website. And today, I'll be sharing a little bit about what we've learned in those. So one of the most important things is to think about what matters most to you. And I'm going to invite you to be thinking about this for yourself, as well as the person that you may be a caregiver for. We know that over 90% of Americans think it's important to have these conversations, but 30% of them have done it. And one of the reasons is, even though it's important to do, it can be hard to think about, what am I going to talk about? I don't know what to bring up. And our guides offer some prompts for that. The first one is this idea of an open-ended question. What matters most to me at the end of life is, and you fill in the blanks. And we have so many types of responses that we've heard from people. Everything from wanting excellent nursing care in a hospital facility, to being sure that my sheets aren't tucked in around my feet, plucking my chin hairs. There's no right or wrong answer to what matters most to somebody, but getting those conversations going with some open-ended questions can really help, and we offer some of those. You can see here some of the answers that people have shared with us. The larger the word, the more common the phrase is that people shared. Peaceful, comfortable, with friends and family. You'll notice that very few of these words are medical in nature, and that's one of the things that we've learned about when people have these conversations, that it's important to talk about what matters to you and not what's the matter with you, that so many of these conversations can be about how you want to live your life. One of the other things we do to try to make this a little bit easier is to think of some scale questions. Sometimes that can be easier for people to reply to. Are you concerned about receiving too much care or too little care? Are you somebody who wants all of your wishes honored no matter what, or what you want people to do what makes them feel comfortable when the time comes? As you think through some of these prompts, they can then give you a starting off point to have a conversation to understand why somebody feels that way. Next, we try to help people think about who they're going to talk to, when they're going to do it. We always know it always seems too soon until it's too late. And so for us, we're trying to encourage these conversations early and often. So we see that to be something important, perhaps coming of age. When somebody turns 18, 21, maybe they're moving out of their home, going to college, moving to another state, their parents aren't their given caregiver anymore. They aren't the automatic decision maker. That can be an important time to have a conversation. Before there's a medical crisis, each decade or major life event, when somebody gets married or has a child or divorced, sometime where the caregiver might change or the decision maker might change, those are important times to have the conversation. A major trip. I know my dad went on a cross-country motorcycle trip a few years ago, and we had the conversation about what he might want if something unexpected occurred while he was on that trip. The same thing could be true if you're a caregiver and you're going to be traveling. It's a really good chance to kind of touch base, make sure the person you're caring for, their wishes are known when you make that handoff. And especially when there's a new diagnosis or a change in prognosis, these are all really good times to have the conversation. It's not something that you do one time and you forget about it and you never do it again. And I also want to note, there's times when people will tell us, oh yes, I had this conversation with my doctor 13 years ago when I had shoulder surgery. I'm sure they still have it on file, what my wishes would be. Or I've done that and I filled out a form and it's in a safety deposit box, but nobody knows where that is. For us, the goal is not only the documentation, even though that can be important, but really talking about what these wishes are regularly so people know where they could find your wishes if you wrote them down or what it is you would want. We then get into a couple of icebreakers. That can often be the hardest thing for people. They know they want to do it, they know what they want to talk about, and they just can't figure out how to get started. So we offer a few icebreakers, like, I need your help with something. Or, I just saw this episode of our favorite TV show, and I saw this scene, and it made me realize I'm not quite sure what you would want in that situation. Can we talk about it? You've got a great icebreaker here of having listened to this session, and you can use that as your example. But similar to that idea of how important it is to listen to what somebody's wishes are, you should also really think about what will resonate with them. Is this somebody who loves TV shows, movies, as I was describing, or a character of a book that they would resonate with? Is there a story in the news, something that's recently happened that you could bring up? We know there are some people for whom they would rather have this be a lighthearted conversation. There's a woman I met in Akron, Ohio, who hosted Thanksgiving every year. She always made the desserts, and she took all of the desserts hostage and said, no pumpkin pie till you tell me how you want to die, and made everybody in the family go around and talk about their wishes. That worked for her family, but for others, that would be deeply unsettling or inappropriate, and they would prefer to be one-on-one or to receive notice ahead of time before having a conversation sprung on them. So really thinking about what's going to resonate most with the person that you're trying to engage and focusing on them and not what you would want in that situation. So that's a little bit of background about us and the Conversation Project, but I want to share with you now some of the tips of what we've seen from people and the examples that they've had. One is to really be thinking about the role you want to play and to be sure that that's known. For example, I was in Las Vegas and met with a woman who told me as she was going through our materials, this makes a lot of sense, but I don't actually care about the type of care I'm going to have. I want my kids to decide what feels best to them in the moment. That's fine, that's great, but she should tell her children that. That's the conversation she needs to have, is I want you to decide when the time comes. Whereas author Katie Butler feels very strongly about the kind of care she would want to receive, especially if she has Alzheimer's or another form of dementia, that she wrote out a very explicit letter to her family, published it on our website, and wants everybody to know the role that she wants to have. So there's no right or wrong answer there. I think also of a man, he was in his 90s, he lived in the Boston area. He had talked to his doctor about the kind of care he wanted and was clear that he did not want extreme measures to be taken. He had a lot of health issues and he felt like he was good to go anytime. And then his doctor came into the hospital. This gentleman was in the ICU getting full care, and he was surprised. What's going on, Mr. Smith? I thought we had an agreement. And Mr. Smith said, my first great-grandchild is due in 2 weeks, and I will do anything I can to be there to meet him. And then we can go back to the original plan. And that is a perfect example of focusing on what matters most to you, not what's the matter with you, but what matters to you, and those wishes can change. And we should be able to adapt to those wishes when you express them. The next is to think about the type of care you might want. And my biggest recommendation here is to have these conversations with your current state and mind and body. Some people will say, I don't know if I'm going to have cancer, or if I'm going to be in a car accident, or I don't know what comes next. And that's one of the points. We can't talk about every hypothetical medical scenario that might play out, but we can answer the questions right now. I know when my husband and I were married, we had the conversation. We sat down to think about our wishes, and he answered every question as if he was 85 years old with Alzheimer's in a nursing home. We were 30 and newly married, and he was in good health. And I said, we have time to get to that scenario. I need to talk about what you would want now if something unexpected occurred. So those are the conversations to have. Another thing that comes up is the idea of home. There's a lot of people where the idea of dying at home is what's most important, and that's not always feasible. It might not be medically feasible, financially feasible, physically feasible. Remember talking to a family in New York on a 5th floor walk-up, how they couldn't care for somebody at home. And it can be helpful to unpack and find out what's most important about that. I know with my grandmother, it was about being with her cat, Pele. She was willing to receive treatment anywhere her cat could be with her, and that was a great guidance for our family on places where she might be able to receive care. So other people, it might be that they don't want to feel left alone, or they want to have a private room, or they want homemade cooking. So finding out what home means to somebody can be really helpful. And to be wary if you hear anybody talk about, if I ever get like that, pull the plug. Or if I ever get like that, I want the whole enchilada. That implies to me that somebody feels pretty strongly, actually, about the kind of care they want, and they aren't quite able to express it. For some people, they might want aggressive comfort measures taken, and others want aggressive treatment. So finding out a little bit more about that type of care can be helpful. The next is to think about the role others might be able to play in this, asking if somebody can honor your wishes. There was a woman we met in Hawaii who originally asked her husband to be her healthcare proxy, and he wasn't able to do it. He said, I can't make those decisions for you. That makes me too uncomfortable. She went to go ask her son, who said, I got it, Mom. You don't want any extreme measures taken. I won't let the doctors hook you up to a machine. You're ready to go now. And she said, no, that's not what I said. She went to another daughter who just cried the entire time and couldn't talk about it. And she went to her third daughter who really listened to what she wanted and said, I understand based on your prognosis, here are the decisions you would want. And that's who she chose to be her healthcare proxy. It can be really important to tell more than one person. There was a woman I met in Florida who said, I'm my husband's healthcare proxy. We've had the conversation, but I'm his second wife. And his adult children don't know that I'm the proxy. And I'm realizing that we can cut off a lot of family angst if he just tells them that I'm the proxy. My mom was one of 7 children, and she was the healthcare decision maker in her family, but they all understood that, and they knew that she was the healthcare decision maker. Somebody else did finances, somebody else did housing, and there wasn't a lot of conflict amongst the siblings because they had all been talked to. And to really be careful of family or caregiver bullying. If you ever notice that people are really pushing somebody to make certain choices, that's a chance to say, we need to center what mom would want in this situation or what this person wants and not what we would want in the situation. And by inviting people to share their wishes with you, you share your wishes with them and invite them to share their wishes with you. The other thing we've learned is that this is really an opportunity to strengthen relationships. They can be very loving conversations. They don't have to be serious. There may be tears, but many times there's laughter, sharing stories, loving with one another. And I think that's been one of the things that's been most exciting to me about the work. These conversations don't promise that there won't be grief when somebody's going through a serious illness or perhaps at the end of their life. But how complicated or how complex that grief can really be influenced by having these conversations. Do siblings still get along after the loss of a parent because they were all on the same page and they weren't fighting? That's the opportunity here that we're really excited by and happy to see. The letters that we received from people about how much more comfort they felt that they weren't questioning the decisions they made has made this project really exciting. So a few tips for how to leave an action. One would be just to get to know our resources and to take this action yourself. Perhaps as a caregiver, you've been focused on the person you're caring for, but you should be sure that you have a healthcare proxy and you have somebody who could speak on your behalf because you can walk the walk and exemplify this to other people in your life. Make sure you document that and start the conversation then with the person for whom you're the caregiver. I'm always excited when people bring this idea of what matters to me back to their own community or their friends and family, people bringing it to their library or their book group, just helping normalize the importance of these conversations. That can go a long way towards making it easier for people to do it. The next is just a couple of messages to remember as you're heading out. One is to present choices at every step. This is the kind of thing where no matter what somebody's illness is or prognosis is, helping them feel like they can make choices is a really helpful thing. You should never hear there's nothing more we can do because there's always more we can do to help somebody feel comfortable. The other is to invite dialogue. We hope that this is a conversation that continues early and often. This isn't one time you get to talk about it and never update what your wishes are. The other would be to kind of invoke a new team, helping people realize it's not just the healthcare team who gets to decide what the medical decisions are. The patient, the caregivers, the people who matter most to them all have a role in this. And with this idea, if you take nothing else away from this presentation, would be the idea of we'll figure this out together. That is a phrase that can go a really long way towards providing comfort and clarity for people, helping somebody not feel so alone while they're living with a serious illness or reaching the end of life. And we would love to be here as the Conversation Project to help. If you have any questions or concerns as you're doing this, we would love to be a part of that. Thank you so much.